Gonna go over chapter 3, the musculoskeletal system. We're going to be looking at some of the things that make up that skeletal system, which are the bones, ligaments, cartilages that make up the framework, some of the skeletal bones and the different words that we use for both. We're gonna look at some different anatomical words. First, a little bit about each. Muscles will cover the bones where they hinge to keep them together. They supply forces that make the movement possible in your body, and it also helps protect internal organs and helps produce body heat. Your skeletal system is going to help support and shape the body. It has bones and cartilage. It stores calcium and other minerals, phosphorus, lipids. It produces certain blood cells within the red bone marrow system. Some of the words that we see, like ankylo, is crooked or stiff. Ankylosing, related to crooked or stiff. Kypho is like something that's hunched back, so kyphosis pertaining to back. We see that some people, the curvature of the spine, some people are born that way. Lithos, smooth, lithomyoma, so smooth muscle tumor. Lordo is bent, lordosis, so we might see that also with a vertebrae. Lumbo is loin or lumbar, so pertaining to the part of the back. Myelo means either bone marrow or spinal cord, so myelitis would be inflammation of the spinal cord. Cranio is skull. Craniotomy is where we make an incision into the skull. Myo, myoso, and musculo, all muscle. So myalgia, so you remember what algae is, referring to pain. Myositis, the inflammation of, and then muscular, pertaining to. Bone is osteo, bone, osteomyelitis, inflammation of the bone, and what else there? What's myel? And then dactyl is digit. When we say digits, that's your fingers and your toes. So dactylgia, it could be painful digits. Patella refers to the kneecap. Pelva is the pelvis bone, pelvimeter, or the hip. Radius is radio is radius, radial. So we're talking about the radius bone. Rhabdo refers to rod-shaped striated skeletal, and that's going to be a rhabdomyoma, referring to muscle that is rod-shaped, and oma would be tumor. Sarco is flesh, so we refer to sarcoma. It's a fleshy tumor. Scolio is twisted, so the scoliosis is where we have a twisting of the spine. Here it shows you an x-ray, which would be scoliosis. You can see that curvature of the spine. Spondylo or vertebral is referring to the vertebrae, so spondylitis vertebral. Sterno is a sternum, so that bone right there that holds your ribs together in the front of your chest. It shows you on that picture. Tino, tendo, and tendon-o are all tendons. Thorax, thoraco is chest. Thoracic would be pertaining to the chest. Tono is tension or tone, myotonia, so referring to the tone of the muscle. Ulno is referring to the ulnar bone, the bone that's in your lower arm next to the radius. When you look at your skeleton, we have appendicular skeleton, so the shoulders, the pelvis, upper and lower extremities. When we have an axial skeleton, which is comprised of the skull vertebral column, so the chest, and then the hyoid bone. We have classifications of bones. Long bones are bones of the arms and legs, so like the femur, tibia, fibula. Short bones would be the wrists and the ankles. Flat bones, so like, again, we were just talking about the sternum, ribs, shoulder blades, pelvis, skull. They're considered flat. Irregular bones, bones of the vertebrae in the face are irregular shape. Sesamoid bones are round bones found near joints. So you'll see like a patella, your knee. Types of bone tissue: compact is considered solid, spongy is soft, and calcareous is soft as well. This kind of gives you a skeleton view. Some of you have taken anatomy already, so you're kind of used to this. The epiphysis is you can see over here on this picture, is the ens. Diaphysis is the mittal. So if you look at this, so you can see like some of the bone is softer, spongier, where the middle is more compact. So that's why you tend to see fractures in certain places. This gives you a picture of the knee. So we often have diseases or conditions associated with that patella or the knee. So you can see the ligaments there. We often have torn ligaments. You could see the meniscus. That's an often area that's you hear torn, like in sports, and that bursa. So bursitis you often hear, which would be inflammation of that. The vertebrae, again, it's a irregular bone. You can see the spinal cord that goes through it there. And then we have the cervical at the very top, thoracic, lumbar, sacrum, and coccyx. We tend to get more fractures in areas that bend more. So at the lumbar, lower thoracic, that part of your spine bends more. So we see a lot more injuries in those areas. And you can see where the disc are in between each vertebrae. So we often have somebody that might have a protrusion of a disc or a ruptured disc, or the disc is eroded and you have bone on bone. This one shows you a little bit of the different muscles, which are tremendous. There's a lot of different muscles. Body planes, so you can see sagittal. So if you're looking at that sagittal plane, you know, what's the lateral and medial? So when we're looking on the outside of the body is lateral, or the inside. So if you're talking about somebody's leg, the inside of the leg is medial, outside is lateral. Where if we look at the anterior posterior, it's front and back. So when I say want an anterior view, let's say of a chest x-ray, I'm going to shoot it looking at their chest from the front and going to the back. If it's a posterior view, it's the opposite. And then the transverse plane, so you can see here, superior cephalic is about the waist up to the head, and inferior caudal is downwards. Body positions, we have erect, which is a normal standing position; supine, which would be laying on your back; prone, which would be laying on your face down; decubitus would be laying down, especially in a bed, like a lateral decubitus is laying on the left side, often referred to as a fetal position sometimes, and recumbent is kind of laying back, more of a reclined position. Here's some other words that you can match with the body, how it works. So like a flexion versus extension. Extension is usually reaching out or pushing out. The flexion is bringing in. Ab and adduction. Ab is away from, where add, you're bringing it into the body. Rotation, so turning one side to the other. When we look at the feet, we have eversion, away, and inversion is in. That might be easy to remember by thinking about N-word. Movements of the hand, pronation is palm down, supination is palm up. And then when we look at the foot, so if you're laying in bed, the foot, you ask somebody dorsiflect and plantar flex. So I like to say plant your foot on the gas would be pushing down, and then bring your toes to your head is dorsiflexion. Common fractures we see, comminuted, you can see where it has multiple fractures there. That one would not be easy to put together. Green stick is often, it's called that because it would be like if you took a stick that's green, it's not dry, it doesn't snap in half, it snaps, but it's not all the way through. You can see it's only broken on one side. Where you have oblique, where you can see it's kind of sideways, and spiral is all the way around. So if you were to twist somebody's arm, and transverse, straight across. And this x-ray is just kind of showing you those as well. It's very difficult to read in X-ray, but you can see that one on the left there, which would be like an oblique fracture. And then there's one on the right would be like a transverse. Some curvatures we see with the spine. The one on the far left is normal. That kyphosis, you can see where the arrow's pointing, it's like a hunchback there. And lordosis, what some may refer to like a sway back. And then scoliosis, you can see the S curvature to that spine. Osteoarthritis, this is going to be where you usually end up having itis is going to be inflammation and of the bone, and that's usually due to loss of cartilage. And so you kind of get bone on bone, which would be usually results in a chronic pain of some sort. Rheumatoid arthritis is where you have some atrophy of the bone. Again, it might be some immunological response here. We often will see the curvature of the bone due to the lack of the bone structure being hard, it becomes soft. So you can see in this X-ray how their fingers will become contorted. Osteoporosis is breakdown of the bone. We usually see this in aging women, usually typically fair complected, so white women with red hair, blonde, blue-eyed. So they tend to lose height. So you can see on the left, that could be a normal person, and then as the person ages and goes through menopause, usually postmenopausal women will lose bone due to lack of estrogen. Some of the tests that we see that would be ordered related to any one of these systems, the electromyogram, the EMG, is a neurodiagnostic graphic record of electrical activity of muscle at rest and when the muscle contracts. So we can use it to diagnose some of the muscular dystrophy type diseases. Magnetic resonance imaging and MRI is going to break down sections of that anatomic structure in very small increments compared to like a regular X-ray. Bone scan is going to be something we do under what we call nuclear medicine. The patient will be injected with some type of nuclear med, so that is highlighted in areas of the bone to detect tumors or malignancy, so presence of cancer. Radiography just refers to imaging using X-rays. Arthrogram would be a radiograph of a joint after the injection of a contrast medium dye. Same with computed tomography, CT scan. We could do that with or without contrast dye, so it highlights areas. And sonography would be what we call an ultrasound, so that's what we call the least invasive imaging that we do, because you don't have to inject anything, and it's on the outside of the skin using some kind of gel just to help with the imaging show up. This gives you a three-dimensional CT here, so kind of computed axial tomography. And you can see it shows different sections. Arthroscopic knee surgery, so where before somebody might have to go to surgery and have general anesthesia and cut open, they can also often do the arthroscopic, so they're just putting in scopes, and they could do that with the local anesthetic. When we say the term ORF, it's open reduction internal fixation. So if somebody has a broken bone, they're going to open it. Reduction is pull the bones back to where they belong. And an internal fixation, we're going to put something in there. So this has like a plate, a metal plate, or screws, or something to connect the bone so it stays together till it heals. Other abbreviations that you'll see, AP would be referring to anterior posterior. So again, going from front to back. BKA is a below the knee amputation versus an AKA is above a knee. CAT is a computed axial tomography, that three-dimensional, where CT is this computed tomography, and that could be with or without contrast. DJD refers to degenerative joint disease. EMG is an electromyogram. FX stands for fracture. Magnetic resonance imaging. NSAID is a non-steroidal anti-inflammatory drug. OA is osteoarthritis. ORF, open reduction internal fixation. When we say PA, it's posterior anterior, so back to front. PT is going to stand for physical therapy. RA, rheumatoid arthritis. ROM is range of motion. and TX is traction. So just go through and look at some of those abbreviations and you'll be ready for chapter 3, musculoskeletal.